Welcome back to MedEd 360. In this video, we're exploring a comprehensive list of life-saving antidotes and treatments for toxicology emergencies. Let's dive into the world of life-saving antidotes. Before going any further, if you're new to channel, make sure to hit the subscribe button and turn on notifications so you never miss an update from MedEd 360. Thank you. Antidotes work in various ways, from neutralizing toxins to reversing drug effects, and knowing them can be life-saving. Whether you're in emergency medicine, pharmacy, or just looking to expand your medical knowledge, this guide will help you understand the essential antidotes used in hospitals worldwide. After understanding what antidotes are, let's start with the basics of managing a suspected drug overdose. First, a thorough history is essential. This often means gathering details from the patient, their family, or any witnesses' information about what substances were taken, when, and in what amounts can guide initial treatment decisions. Next, a physical examination can offer vital clues. Certain signs and symptoms can suggest specific toxicities and help direct further investigation and treatment. From changes in vital signs to altered mental status, every detail counts as we determine the best course of action to support the patient. Now that we've gone over history taking and physical examination, let's dive into the three most important steps in managing an overdose. The first step is to resuscitate the patient. Our top priority in any overdose situation is to stabilize the patient's airway, breathing, and circulation. Resuscitation might include oxygen support for fluids, or even advanced airway management depending on the severity. We have to act fast to ensure that the patient's vital signs are maintained. Second, reduce the drug's absorption. This step varies based on the type of drug and the time since ingestion. I will discuss this later. And finally, administer an antidote if one is available. Certain overdoses have specific antidotes that can directly neutralize or counteract the effects of the drug. For instance, naloxone can be life-saving in opioid overdoses. Having an antidote available and administering it promptly can make all the difference in the patient's outcome. So remember, resuscitate, reduce absorption, and administer an antidote if available. Now, let's talk about ways to reduce the absorption of a drug after an overdose. This is a critical step in limiting the body's exposure to the substance. Here are some methods commonly used. First, this is rarely used and only considered for potentially life-threatening overdoses if done within an hour of ingestion. Gastric lavage involves inserting a tube into the stomach to flush out its contents, but it's only effective in certain cases and comes with significant risks. It should only be performed by experienced clinicians and is not suitable for corrosive or hydrocarbon ingestions, as these could cause additional harm. Second, activated charcoal. Given as a single 50-gram dose, activated charcoal can bind many drugs in the stomach and prevent further absorption if given within an hour of ingestion. However, it's ineffective for certain substances like iron, lithium. For some cases, multiple doses of activated charcoal may be used. For example, 50 gram every 4 hours or 25 g every 2 hours. This can increase the clearance of certain drugs by interrupting their recycling through the liver and intestines. Then, there's whole bowel irrigation. This involves giving a solution of polyethylene glycol, also known as clean prep, either orally or via a nasogastric tube, at a rate of 2 liters per hour in adults. The goal is to flush the intestines until the contents are cleared. This method is especially useful for sustained-release or enteric-coated toxic drugs, like calcium channel blockers, lithium, or iron, and for cases involving the body packers who have swallowed packets of illicit drugs. Finally, it's important to know what's not recommended anymore, like ipecac syrup to induce vomiting. This method is no longer used due to the potential for complications and limited effectiveness. So, when dealing with overdoses, remember that reducing drug absorption is time-sensitive and must be tailored to the specific drug and patient condition. Each of these methods has specific indications and contraindications, which helps ensure the safest, most effective approach. Now, let's talk about specific overdoses and their corresponding antidotes, starting with one of the most common medications, paracetamol. Although paracetamol is available over the counter, it can be highly toxic in large amounts. Toxic doses typically start at around 150 milligrams per kilogram for adults, but even lower doses can be harmful in certain cases. The main antidote for paracetamol toxicity is acetylcysteine, which works by replenishing glutathione, a substance that helps the liver process the toxins. Given early enough, acetylcysteine can significantly reduce liver damage. Next, organophosphorus poisoning. Often linked to exposure to certain insecticides, herbicides, and other chemicals used in agriculture, organophosphorus poisoning is relatively common in areas with high pesticide use. The antidote here is atropine, which is given to counteract the effects of excessive acetylcholine in the body. Atropine dosage varies depending on the severity of symptoms, and it's often administered until respiratory secretions are manageable and the heart rate stabilizes. Finally, calcium channel blocker overdose. This can occur with medications used to manage blood pressure and heart conditions, like verapamil and diltiazem. Calcium channel blockers can slow the heart rate and lower blood pressure to dangerous levels. The antidote for this is calcium chloride. Administered intravenously, calcium chloride helps counteract the effects on the heart and circulatory system by restoring calcium levels and supporting muscle contraction. Now, let's look at benzodiazepine overdose. Benzodiazepines, often used for anxiety and sleep disorders, can cause sedation, confusion, and even respiratory depression when taken in excessive amounts. For benzodiazepine toxicity, the antidote is flumazenil, which works by blocking the benzodiazepine receptors in the brain. However, it's important to note that flumazenil is used with caution because it can trigger seizures in patients who are dependent on benzodiazepines or in those with mixed drug overdoses, like benzodiazepines combined with tricyclic antidepressants. Next, beta blocker overdose. Beta blockers, used to manage heart rate and blood pressure, can slow the heart rate and lower blood pressure too much in cases of overdose, leading to severe hypotension and even shock. The antidote here is glucagon. Glucagon helps by increasing heart rate and blood pressure through a different pathway than beta receptors, bypassing the blocked beta receptors affected by the overdose. In severe cases, glucagon is administered as a bolus, followed by an infusion to stabilize the heart rate and blood pressure. These antidotes, flumazenil for benzodiazepines and glucagon for beta blockers, are critical in reversing the life-threatening effects of these overdoses. If you're finding this information helpful so far, don't forget to give a thumbs up and subscribe to stay updated with more essential medical insights. Your support helps us bring you more valuable content. Now, let's look at 3 more specific cases of overdose and their antidotes: methemoglobinemia, opioids, and tricyclic antidepressants TCAS. Methemoglobinemia occurs when there's an abnormal amount of methemoglobin in the blood, which can reduce oxygen delivery to tissues and lead to cyanosis, confusion, and even severe hypoxia in high levels. Common causes include certain medications and chemicals, like local anesthetics and nitrates. The antidote for methemoglobinemia is methylene blue. Methylene blue helps by converting methemoglobin back to normal hemoglobin, restoring oxygen delivery in the body. It's typically administered intravenously in moderate to severe cases. Now let's talk about opioid overdose. Opioids are widely used for pain management, but can lead to dangerous respiratory depression and unconsciousness in overdose situations. The antidote for opioid overdose is naloxone, a fast-acting opioid antagonist that reverses the effects almost immediately. Naloxone can be given intranasally or intravenously, and multiple doses may be needed depending on the severity of the overdose and the opioid involved. Now, tricyclic antidepressant overdose. TCA are used to treat depression and certain pain disorders and can cause life-threatening cardiac and neurological symptoms in overdose, including seizures, arrhythmias, and hypotension. The antidote here is sodium bicarbonate, which helps to counteract the cardiac toxicity caused by TCAs, especially by correcting the acidosis. In severe cases, it's given as an intravenous bolus, with repeated doses as needed. These antidotes, methylene blue for methemoglobinemia, naloxone for opioids, and sodium bicarbonate for TCAs, are essential drugs for managing these critical overdoses. Let's continue with more examples to deepen our understanding. Next, let's cover iron, digoxin, and heparin overdoses and their antidotes, which are vital in managing these toxicities effectively. Iron overdose. Iron poisoning can occur from the ingestion of large amounts of iron supplements, especially in children. It can lead to vomiting, diarrhea, metabolic acidosis, and even shock. The antidote for iron toxicity is deferoxamine. Deferoxamine is a chelating agent that binds to free iron in the blood and promotes its excretion through the urine. In severe cases, deferoxamine is given intravenously to rapidly remove toxic iron levels from the body. Digoxin overdose. Digoxin is used to treat heart failure and atrial fibrillation but can be toxic in excessive amounts, leading to arrhythmias, confusion, and even death. The antidote for digoxin toxicity is digoxin-specific antibody DGFAB. This antibody binds to digoxin molecules in the bloodstream and neutralizes their effects, reversing the toxic symptoms quickly. Heparin overdose. Heparin is an anticoagulant used to prevent blood clots, but in overdose, it can lead to uncontrolled bleeding. The antidote for heparin overdose is protamine sulfate. Protamine sulfate neutralizes the anticoagulant effect of heparin by binding to it and forming an inactive complex. It's typically given intravenously and works quickly to reverse heparin's effects. Now, let's discuss three more important overdoses: methanol, sulfonylurea, and warfarin, and the corresponding antidotes that can save lives in these situations. Methanol overdose. Methanol is a toxic alcohol commonly found in antifreeze, industrial solvents, and some illicit alcohol. When ingested, methanol is metabolized to formaldehyde and formic acid, both of which are highly toxic. The antidote for methanol poisoning is fomepizole. Fomepizole works by inhibiting alcohol dehydrogenase, the enzyme responsible for converting methanol to its toxic metabolites. If fomepizole is not available, ethanol can be used as an alternative, as it also inhibits alcohol dehydrogenase and prevents methanol metabolism. Methanol poisoning can cause blindness, metabolic acidosis, and even death if untreated. What about sulfonylurea overdose? Sulfonylureas are oral medications used to treat diabetes, but an overdose can lead to prolonged hypoglycemia, low blood sugar. The antidote for sulfonylurea toxicity is octreotide. Octreotide is a somatostatin analog that inhibits insulin release from the pancreas and helps to raise blood sugar levels. In severe cases, glucose can also be administered to manage hypoglycemia, but octreotide provides more targeted management of sulfonylurea-induced insulin release. And now the last antidote of today is for warfarin overdose. Warfarin is an anticoagulant used to prevent blood clots, but an overdose can increase the risk of bleeding. The antidote for warfarin overdose is vitamin K, phytonadione. Vitamin K helps to reverse the effects of warfarin by promoting the synthesis of clotting factors in the liver. In cases of life-threatening bleeding or rapid reversal, fresh frozen plasma, FFP, or prothrombin complex concentrates, PCC, may also be used in conjunction with vitamin K to immediately restore clotting factors. Let's quickly recap the antidotes we've discussed today. The antidote for paracetamol acetaminophen is acetylcysteine. For organophosphate poisoning, it is atropine. For calcium channel blockers is calcium chloride. For benzodiazepine overdose antidote is flumazenol. For beta blockers overdose antidote is glucagon. Methylene blue is used for methemoglobinemia. Opioid overdose is treated effectively with naloxone. Tricyclic antidepressants toxicity is treated by sodium bicarbonate. Iron overdose NEDs deferoxamine. For digoxin overdose, digoxin-specific antibody is used. Heparin overdose is corrected with protamine sulfate. Methanol poisoning is treated with fomepizole or ethanol. For sulfonylurea overdose, the antidote is octreotide. Warfarin overdose is corrected by vitamin K. Thanks for watching. If you found this video helpful, make sure to hit that like button, subscribe to the channel, and share this information with anyone who might need it. Got any questions or suggestions? Drop them in the comments below. And remember, staying informed can save lives. Until next time, stay safe,